Classification of the adverse effects. Classification of the adverse drug reactions. In these adverse drug reactions, there are so many classifications are there. In them, we have to know about some topics. They are, first of all, predictable or type 1 or non-immunologic reactions. In this type of reactions, the qualitative response are the qualitative response are normal but quantitative responses are abnormal. These responses are predictable reactions are less serious, commonly occurring dose dependent reactions and which are responsible for the adjusting the dose of drug. Some predictable reactions are given in below. There are some types. For example, excessive pharmacological effect, side effects, toxic effects, and these are the some predictable reactions of the drug adverse reactions. Excessive pharmacological effect, it develops in patients if the dosage is given excessively. In that time, the cardioactive agents and central nervous system depressant, it will be occurred in the patient. It is common in neonates, infants and elderly patients. Also some patients who are having kidney illness and these excessive pharmacological effect mostly seen in 70% of the kidney function with the normal doses. It is also common in the patients with lower albumin level due to the liver or kidney damages. For example, at excessive dosage of the digoxin produce bradycardia and excessive dose of the morphine causes respiratory depressions or bronchitis in the patients. These are called as side effects. These side effects are some extension of the pharmacological effects which is produced by the therapeutic doses. In these doses, these are related to the nature. The side effects are results as extension of the same therapeutic effect. For example, atropine produce much toxicity than the paracetamol. The side effects is different to drug. So, another example that is promethazine, it is act as an anti-allergic which produce sedation also. While it taking in excessive form, these promethazine causes sedation in the patients. And some drugs are given below. They are codeine. Codeine excessively taking administration of the codeine, it causes diarrhea, and excessive taking of the sulfonylureas or causes diabetes. Prazosin produces the postural hypotension. Hypokalemia produces furosemide, and nitrates produce the headache. These are some side effects of the drugs. And what is the difference between the side effects and the toxic effects? Side effects means it can be diagnosed by the doctors, but toxic effects, these are extreme to the side effects. So that's why there is small difference, that is side effects and toxic effects. Toxic effects are harm to the body and side effects also harm, but it is slow process. When compared to the toxic effects, the side effects are the slow processes. In this toxic effect, it produces the overdose usage of the drug. They are atropine causes delirium, paracetamol causes hepatic necrosis, barbiturates causes coma, morphine causes respiratory failure. And some pharmacological effects of the toxicity drugs. They are while patient receiving the antihistaminic drugs for prevention of the motion sickness, it became corrosive. In another case, the vitamin deficiency can occur in the patient whose normal bowel flora has been altered by the antibiotics like tetracyclines. By administration of the tetracyclines, it can cause the abnormality in the bowel movements. And rebound responses after the drug withdrawal reactions. The use of long-term medication produce the tolerance at cellular level. Sudden withdrawal of such medication can give rise to the adverse effects. These reactions occurs in the absence of the drug, which causing the common with the drug which acting on the central nervous system. For example, the narcotics, analgesics, hypotonics, ethanol, these are the some drugs which are related to the central nervous system. It can also result with the some antihypertensive drugs and corticosteroids. The withdrawal effect of these drugs can be minimized by the gradual withdrawal of the drugs. Some given examples are there. They are used for the drug withdrawal response. They are clonidine. Clonidine is the antihypertensive agent which causes the hypotension if it uses discontinuously. The long-term use of CNS depressants like benzodiazepines, barbiturates, it causes confusion and delirium, tachycardia in the patients. Anti-epileptic drug withdrawal may also causes the seizures in the patients. So these are the some type of predictable reactions in the adverse drug reactions. And where it comes to the unpredictable, these reactions are generally results to the presence of some patients. For example, allergy, idiosyncrasy, these are comes under into the unpredictable adverse drug reactions. These reactions is based upon the patient and drug action. The less use of the dose which is independent to the reactions are more serious than the intermediate withdrawal of the drug. Some types of unpredictable reactions are given. They are idiosyncrasy, pharmacogenetics, genetically determined toxicity, allergic drug reactions, supersensitivity, photosensitivity, intolerance. These are the some types of the unpredictable adverse drug reactions. Idiosyncrasy. The idiosyncrasy refers to inherent peculiarity of the individual drug which responds to the drug are highly exaggerated by the some drugs with use of the few individuals. Idiosyncrasy, which refers to the inherent peculiarity of the individual and described response to the drug, which exaggerated usage of the drugs with usual dose in few individuals. It is genetically determined as a atypical or bizarre effect. Some following examples are given to find the idiosyncrasy reactions. That is, administration of the analgesic drugs to the patient with renal disease may induce the tumors of kidney pelvis. High doses of the stilbestrol during pregnancy produce vaginal adenocarcinoma. Long-term use of the estrogen produce uterine cancer. Long-term use of the azeitropine cyclophosphamide, it produces lymphoid tumors. Barbiturate produces the mental confusion. Prolonged use of aspirin which produce bronchial asthma. This is about the idiosyncrasy. B. Genetically determined toxicity. The reactions which occurs in the patients with special genotype or genetic makeup. In some literature, these reactions can include in their idiosyncrasy reactions. For example, hereditary deficiencies of the plasma cholinesterase. It is unable to hydrolyze the succinylate, thus it causes prolonged apnea of the plasma cells in the case of pseudocholinesterase deficiency. Some type of drugs which metabolized by the acetylation in the liver enzyme. For example, procainamide, isoniazid, hydrazine. It shows the slow acetylators. In these drugs, the response of the drugs are very slow, and it results into development of the systemic lupus with the polyneonites in which isoniazid. Allergic drug reactions. In the allergic drug reactions, in these allergic drug reactions, all reactions are mediated by the antigen-antibody reactions with involving sensitizing lymphocytes. Drug acting on the foreign antigen which is reacted with the antibody. When antigen is reacted with the antibody in human beings, it causes the undesirable effects like skin rashes, bronchospasm, angioedema, anaphylactic shock, etc. These reactions require previous exposure to the drug. These allergic reactions is not a dose related and it has no correlation with the action of the drugs. That's why it is called as a allergic drug reactions. The protein and peptides, these are also complete antigen, but most of the drugs are small molecules and do not stimulate with the antibody production. But they are combined with the carrier molecules to function the antigens, to produce the antibodies, to fight against the antigens. And this is about the allergic drug reactions. Anaphylaxis. It is the most serious type of the drug allergic reaction. It involves the formation of specific type of the antibodies that belong to the IgE class. These antibodies are present on the surface of the cell tissue which exposed to the antigen to combine antibodies on the targeted tissue and result into the liberation of the inflammatory medications. Examples for the anaphylaxis is penicillin, dextran, anesthetics, iodine containing compounds. It produces the anaphylaxis reactions. And quinine, thiazide, digoxin, these produce the thrombocytopenia. Supersensitivity. In this supersensitivity, the increased responsiveness of the drug which produce the derivation of the administration after a long period of time. For example, the blocking of dopamine receptor by the chlorpheniramine, it causes supersensitivity by regulating the dopamine receptors. Photosensitivity. It is phototoxic and photoallergic reactions. In this photosensitivity, the patient who is sensitive to the photo or light, it is called as photosensitivity. In these reactions, the drug accumulated with the skin which absorb the light on exposure to the light which result into photochemical reactions. It also damages the tissues of the cells. Intolerance. It is the opposite of the tolerance. Tolerance means patience. It is intolerance. It is appearance of the adverse drug reactions at therapeutic dose levels. Some examples of the intolerance are chloroquine, which causes vomiting and abdominal pain. Phenobarbital causes mental confusion.